Hi, I'm Dr. Ahmed Hussain Pathan, Consultant General and Laparoscopic Surgeon, and you are watching my YouTube channel SurgiTalks. My today's topic is arthritis. Arthritis is the common problem in the especially elderly people, and there are three main types of the arthritis: osteoarthritis, rheumatoid arthritis, and the gout. It depends upon the symptoms of the particular type. Including the causes of the arthritis, the main causes are the infection, autoimmune disorder, family history, trauma. The people who are suffering from arthritis, they have different types of the symptoms like redness and swelling over the joint, pain in the joints, especially the morning stiffness and the severe pain in the morning after awaking from the sleep. And other symptoms including the tenderness over the joint. So the patient who are suffering from the arthritis, they must consult with the physician to diagnose and get treated with the arthritis. So to diagnose the arthritis, physician will examine the patient, take the history and do the clinical examination. On the basis of history and clinical examination, first of all, physician will exclude or diagnose the what type of arthritis it is. It is either rheumatoid arthritis, it is osteoarthritis, or it is the gout. So every type of arthritis has the different symptoms. In rheumatoid arthritis, mostly small joints are affected and morning stiffness in the small joints, especially in the hands. And in osteoarthritis, the main joints affected are the knee and hip joints and other in the spines, joints of the spinal cord. And in gout, the most affected areas are the big toe of the foot and the ankle joint. So these are the different sites which are affected as per the type of the arthritis. And the symptoms also vary from the type of the arthritis. In gout, there are severe pain on walking, and on arthritis, morning stiffness and severe pain in the small joints. And osteoarthritis, the pain especially in the knee joint and the hip joints. So after detailed history and clinical examination in which the physician can examine and see the redness, tenderness and swelling on the joints, physician will advise for certain investigations. And investigations we divide into the lab investigations and the radiological investigations. And radiological investigations start with the X-rays, particular joints, and then if needed can be advised the MRI. For rheumatoid arthritis, the blood investigation include the RF factor, and to exclude the gout, the uric acid test will be advised to see the levels of uric acid and diagnose as a gout. So after the investigations, the turn is for the treatment. In treatment, the treatment depends upon the particular the type of the arthritis. When we are talking about the gout is occurred because of the increased uric acid level, and it also affects the kidneys and pain in the ankle and the big toe. So after symptoms, the treatment will be started as per the levels of the uric acid level, rehydration, increase water intake, and avoid the meals which increases in the level of the uric acid, and also with the painkillers and the anti-uric acid drugs can be advised. So in rheumatoid arthritis, the painkillers and other exercises can be advised, and the main treatment is advised start with the lifestyle modification. And all of the types of the arthritis start with the lifestyle modification. It's because it occurs in the elderly people and also the people who are over in weight, who have obese and or super obese and heavy weight. So and their mobility is decreased. So then the problems can occur. So the lifestyle modification starts with the exercises and walk. At least recommendation is the 10,000 steps in a day. With this, you can mobilize the joints and also mobilize the muscles of the body as well. So after exercises, increase water intake, rehydration, and reduce the weight, especially those who are overweight people. So after the lifestyle modification, then the medication like painkillers can be advised. The painkillers, prolonged use of painkiller can affect the stomach and it causes gastritis and the peptic ulcer, as I told you in my previous topics like peptic ulcer and gastritis. So try to avoid prolonged use of painkillers, especially in the empty stomach. So try to get control over the by lifestyle modification and exercise. And if you cannot relieve, then you can get the painkillers. And if the painkiller cannot control the pain, then the local injections or block can be offered. So in the particular affected joint, the local injection can be infiltrated. The injection consists of the painkiller and the steroids material. So these combined injections can be injected in the particular joint to get relief, especially those who have severe pain and severe immobility and cannot relieve on the pain and the lifestyle modification. The physiotherapy has a vital role in controlling the arthritis. So the physiotherapy not only relax the joints, they increase the mobility of the particular joint. So and by physiotherapy, the person can also avoid the medications. And then the last, if all the measures become fail, and the lifestyle modification, physiotherapy, and painkillers and steroid injections, even after that, the movement of the particular joint cannot develop, and the immobility of the patient increases, and the lifestyle modification can also, or the mobility can affect the routine life of the patient. Then lastly, we advise for the surgery, and especially in the knee and hip joint, we can offer the replacement of that particular joint with the knee replacement and the hip replacement. So the message is that elderly people who are overweight, they must try to reduce their weight, increase their mobility, don't confine themselves at the home. They get at least 10,000 steps per day, and do the regular exercises, rehydrate themselves, take multivitamin like vitamin D, calcium supplements, and the fish oils, medicines, so to relieve or to avoid the arthritis. And if they, even after that, the symptoms develop, immediately consult with the physician and try to control the disease in the early stage. Thank you very much. Like and subscribe my channel and share with your family and friends.